Erin Harner, gut health, IBS, and SIBO coach and functional medicine dietitian, and I want to just welcome you here. This is the live Q&A with me. I had a number of questions submitted by community members, and I'm going to go through those now with you. All right, let's go through this question from Kathy. So she said, I just finished rifaximin for SIBO, and I'm still bloated and nauseous. I also took Flagyl. What else can I do? First, let me just break this down for a second. So the first thing is SIBO. What is SIBO? SIBO is small intestinal bacterial overgrowth. That's what SIBO stands for, SIBO. And there's a few different types of SIBO. There's hydrogen predominant, there's methane predominant, and then the one we know a little less about, but we still know some about, is hydrogen sulfide. So it sounds like from her gastroenterologist was prescribed rifaximin, which is a gut-specific antibiotic. Often used for hydrogen SIBO or in combination for methane predominant SIBO or intestinal methanogen overgrowth, also known as IMO. So I'm throwing out a lot of acronyms, so just bear with me for a second. So these are prescription medications that she's referring to. So what else can I do if I took these things and I'm still bloated and nauseous? The first thing I would say is join the club. It's pretty common to do a combination of drugs for SIBO and not have much benefit. Why? Because SIBO treatment often fails because you don't address the why. Why is it there in the first place? There's supposed to be lots of bacteria in the large intestine, not the small intestine. Why is it in the small intestine? If we don't address why it's there, no amount of rifaximin, neomycin, Flagyl, herbal antibiotics, I don't care, whatever you're using, they're not gonna correct the problem, because the problem is that there's something going on, usually upstream or downstream, that's making an overgrowth of bacteria in the small intestine. So the reason that you still might be bloated or nauseous is because you haven't actually addressed why it's there in the first place. Oftentimes I'm thinking about motility. Do you have slow motility? Is food moving slowly through your whole digestive system? If food's moving very slowly, we can have overgrowth of bacteria in the small intestine contributing to some of these symptoms, like the nausea and the bloating, for sure. That's why so many of my clients will come to me after 2 or 3 rounds of antibiotic treatment from their gastroenterologist, and they're like, Erin, I don't understand. Like, I keep trying this thing, it's not working, what do I do? That's why they end up seeing me. So they still feel awful because they haven't actually addressed why. And these why factors are often related to gut motility, stress, or diet. Nutrition plays a huge role in SIBO, in the clearance of SIBO, in the prevention of SIBO. But if we don't think about preventing it in the first place, no amount of treatment is going to just magically make it go away if we haven't addressed why it's there. And that's one of the core tenets of functional medicine. So if you're wondering how I practice, this is how I practice. I'm going to share a lot of kind of key insights and pearls with you throughout the questions to help you understand how this all works. You have to address the underlying root causes of why it's there in the first place. And also you have to rebuild the gut microbiome. If you just throw a whole bunch of antibiotics, whether they're prescription antibiotics or herbal antibiotics, at an infection in the gut, and you don't do anything to rebuild and repair the gut lining and restore good bacteria into the gut, you're likely going to have relapses and overgrowths again because you haven't addressed this imbalance, right? You're creating a dysbiosis by knocking down a lot of the bacteria, and what regrows is whatever is left over. And sometimes that's not the desirable organisms that you want in your gut. You've really got to kind of weed them out, and then you've got to feed them appropriate nutrients so that they can thrive and flourish and regrow in a way that is healthy and makes you feel good. When we're thinking about SIBO in particular, we have to think about it holistically. We can't just think about, okay, there's a lot of bacteria in your small intestine. Those bacteria in the small intestine are likely creating a lot of havoc. They're producing a lot of gas. They're creating a lot of pain. But why are they there? And how do we address them holistically so that they can get rebalanced and not come back? And that really is not just putting antibiotics at them. It's a whole body approach, top to bottom, optimizing digestion, and also really understanding the nervous system and nutrition and lifestyle factors that impact how it became a problem in the first place. So hopefully that helped address that question, Kathy. Next question was from Brittany. How do I know if I have SIBO or just IBS? Another SIBO question. I think of SIBO more as a symptom than a cause. Let me explain that for a second. It's very true. There's a lot of overlap between SIBO and IBS. And SIBO is small intestinal bacterial overgrowth, basically an overgrowth of bacteria in the small intestine. IBS, or irritable bowel syndrome, is a cluster of symptoms that occur And once a lot of other things are ruled out, the physician will diagnose it as IBS because they don't know what else is causing it. Keep in mind for both SIBO and IBS, it's usually caused by something or many somethings, not just like one standalone thing. So we have to understand what's actually causing the symptoms. And that's really understanding the root causes. And it's true, like depending on the paper that you read, anywhere between like 30 and 70% of diagnosed IBS cases are actually related to SIBO. So if we can address the SIBO, we can help with the IBS. Keep in mind, these are just labels. They're not root causes. So if we want to determine whether it's a SIBO or whether it's IBS, it's very helpful to do a SIBO breath test or use a device to measure gas levels to see what's actually going on. Gas levels is one way that you can understand SIBO or small intestinal bacterial overgrowth. Are you producing methane? Are you producing hydrogen? I also really like to do stool testing in my practice, but keep in mind that we can't really understand what's going on with bacteria in the small intestine by looking at stool, because the place that it came out of most recently is the colon and the rectum. So we need to test for things appropriately. And if you go to a gastroenterologist and you ask this question, know that many gastroenterologists are not super well versed in SIBO or understand the nuances behind, you can't just give an antibiotic and expect it to go away. So that's thoughts of mine on that topic. All right, moving on. A question from Amanda. Sometimes I'm constipated, sometimes I have diarrhea. Is that normal? Normal is such an interesting thing, because normal is something that we don't usually talk about when it comes to poop. So few people have conversations about bowel movements in regular life. We often don't understand what normal even means. If you go to a gastroenterologist and you say, is this normal? They're probably going to say, tell me more. At least I hope they would. So tell me more, right? Like what's going on? How often are you constipated? How often do you have diarrhea? How long has this been going on? And these are many of the questions that I ask as well. If this has been going on for at least 3 months and it's truly constipation and truly diarrhea, there could be like IBS-M, for example. A gastroenterologist might diagnose this as, or mixed type IBS. It's a sign of gut dysregulation, right? There's something going on in the gut-brain axis, there's dysbiosis, there's overgrowth of bacteria, there's something that's causing this shift, this back and forth between constipation and diarrhea. So it's really, really important to understand what's going on. My goal for my clients is to have smooth, soft, Bristol stool chart type 4 bowel movements 1 to 3 times a day. That's my goal for my clients. If it's more than that, or it's really runny, that would be diarrhea. If it's less than that, or it's particularly if you're having bowel movements less than twice a week, that would be considered constipation. So swinging back and forth is definitely something that needs to be sorted out. You need to understand what the root causes are so you can address them. And the thing is it's different for everybody. Not everyone, even with a diagnosis of like IBS-M, is going to have the same reasons for why they're having those same symptoms. One of the things that you can do if this is the case is really making sure that you're having similar routines day to day as much as possible. Like if you always take a walk in the morning after you eat breakfast and you sit down on the toilet and you have a bowel movement, right? Like just sleep patterns, morning daylight, movement, these things all matter. So having a predictable rhythm in your day can help create a predictable rhythm in your bowel movements. So great question, Amanda. Thanks so much for asking. Definitely worth digging deeper to figure out what might be going on. I had a question come in the live. This one was from Carol, who asked, can you talk about low pancreatic elastase? So when we're thinking about pancreatic elastase, this is going to be coming from a stool test. Pancreatic elastase 1, you might have seen from a stool test from a gastroenterologist. You might have seen in something like, I use the GI map in my practice. It is a comprehensive stool test that looks at both digestive function and what's going on in the microbiome. Pancreatic elastase is definitely on there. And pancreatic elastase 1 in particular, if that is low, what we can infer from that is that the production of pancreatic enzymes is impaired. There's not enough enzymes to break down the food. And enzymes are something that's very, very important to break down carbohydrates and proteins and fats. If we're thinking about pancreatic elastase, that's something that you definitely want to chat about with your gastroenterologist or your doctor if you have questions, or you can book a call with me and we can chat through what's going on for you and figure out how to support you. But pancreatic elastase, it's a little bit more complicated than I just explained, but if pancreatic elastase is low, bottom line, low pancreatic function will prevent good breakdown of your food. So let me explain enzymes real quick. So if we think about enzymes, we think about foods like proteins or carbohydrates being long chains. So let's think about them as like a long pearl necklace. And what enzymes do is they come in and they clip the pearl necklace into little pieces. And each enzyme has a specific place in these proteins or these carbohydrates or the fats where they clip. Okay, so if we're specifically thinking about carbohydrates, for example, we could break down into disaccharides, for example, or single sugars. So we're going to come in with the enzymes and we're going to clip at different places of the long chain. And what happens is if we don't have enough enzymes, we have these long chains of proteins or carbs or fats that are not properly broken down. And if they're not properly broken down, we can't absorb them in our small intestine. And they become food and fodder for all of the microbes that are living in your small and large intestine. And sometimes they'll just go to town breaking them down, creating a lot of gas. Or they can cause other issues with malabsorption or a lot of pain. So pancreatic enzyme function is really, really important and something that I definitely pay attention to. So thank you for that question, Carol. There were some really great questions that came in. Also, if you're still watching and these questions hit close to home, I just want to let you know that you're not broken. Your symptoms are not your fault. If they're still there and you've tried a bunch of things and you're like, I don't know what to do next, nothing is helping, it's likely that you don't have the right plan. Or you haven't dug deep enough yet to figure out what the root causes of the actual issue are. We talked about IBS, we talked about SIBO, we talked about constipation, we talked about diarrhea, we talked about gas and bloating and lots of different symptoms. These symptoms don't just come out of the blue. They're red flags. They're your body telling you that something is going on and you probably need to address it, because if you don't address it, what happens is over time it gets worse. So if you're wondering so I feel like I need a plan, but I don't know what to do, I would encourage you to book a call with me. I've been a health coach and a dietitian for a long time. I really like to get to understand you and what's going on for you and how to support you in the best way possible. So if you're frustrated, if you're feeling stuck, if you're like, I've tried this antibiotic and that antibiotic and my SIBO keeps coming back, book a call with me. I would love to chat, because it's likely that you're missing something. We're not digging deep enough. There are roots underneath the surface that we can't see, because all we're doing is we're looking at the tree and all the symptoms on the tree, the gas, the bloating, the diarrhea, the constipation, the reflux, etc. They're all in the tree. We haven't dug into the roots. Thanks so much for being here, and we'll talk to you again soon. Bye, friends.